As we look at the formative skill assessment, I'm just going to step a little backwards and really take a more gross view at what are our current gaps in skill transfer, because all of us are in the business of empowering our AOPs with very specific skills. And then how can formative assessment be a very important part of that journey of how we can ensure the effective skill transfer to the trainees? What are some tools that are there for skill transfer? We're going to explore a bit of that. And then visit some important points for how we can make this skill transfer successful. All of us are, like I mentioned, focused towards ensuring that our trainees learn these critical skills, very specific skills required for ophthalmic practice. It could be assisting in this theater, it could be doing an OCT, it could be as simple as escorting a patient from one place to another. For all of this, we need to ensure that our trainees are truly competent to perform these skills. But I think this is definitely true for our team, and I think many of us may be familiar with some of these challenges. I do not know if the trainee has truly learned the skill, has learned the skill completely. Sometimes we see that the trainee we don't have enough time for practicing under supervision. We maybe one or two times they're able to supervise, but we're not having sufficient practice till they become completely confident. That level of confidence, I don't know if all of us can say we have. The learner is not always clear where he or she is going wrong, or they may be wrongly confident that they know the skill, when in fact some places they're still lacking. We sometimes see that the learner continues to make the same mistakes again and again. And then we also see not only learners, people who are in our team, employees, they sometimes don't follow the protocol completely. And then we also have this additional struggle of everything changing. Our protocols keep changing, and we struggle to ensure that all our staff are abreast with these changes. If you are familiar with one or two or all of these challenges, then I think this presentation will be relevant to you. So skill transfer means that we should be able to demonstrate that the learner is able to perform a procedure following a standard process, is able to achieve accurate results in a safe and patient-centric manner. I'm going to break this down a bit because this is important. When I say an allied ophthalmic personnel, it could be a refractionist, it could be a theater assistant, it could be an ophthalmic assistant, vision technician, so many names, so many roles. But when I have to say this person is competent, he or she must be able to demonstrate that the learner is able to perform that procedure. Let's say here, perform Perkins tonometer following a standard process. What is the standard process? Do we know what we mean by standard process? Is this documented? Do we have standard operating protocols for each and every procedure? Very important to start with. Okay, the person is able to do the process step by step and show you the process. Are they achieving accurate results? Are they getting the correct results? Again, what do we mean by accurate results? It could mean something that a trained, well-accomplished employee is able to show a certain IOP reading. Then is the trainee also able to show the same IOP reading? And are they able to do all of this without compromising patient safety or even employee safety? Are they able to do it with empathy, like Dr. Rasimsil said, not just following the process? It's very important to also ensure that they are treating the patient with dignity and compassion in doing all of this. Now, now I want to say how formative assessment helps us achieve all of this that we spoke about earlier. How can formative assessment help you ensure that an AOP learner is going to be truly competent. So here you're seeing somebody practicing bandage tying. So formative assessment is, importantly, it's a formal assessment. This is not an informal assessment. I want to stress on this. When I say formal, it means it's documented, and it is not meant to assess someone as much as it's supposed to help in learning. So formative assessment is part of an ongoing learning process. This is also very, very critical. And it really helps in giving constant feedback. This is probably a very, very powerful tool that you have in your hands. If we do it well, our learners will know exactly where they're going wrong. This is not a situation where we're going to pass or fail a candidate. Here, we are doing all of this assessment only for learning. So some of the things that can help is like a checklist. Some of you have already seen this. You use a more advanced tool is a rubric, which we saw in our previous webinars. Dr. Carl Golnick and Dr. Eduardo have shared. You can see, for example, this is a how to measure visual acuity, this step-by-step process. So it's just a checklist. Did the person do it well, or did they do the step, but it needs improvement? No, they didn't do it quite so satisfactorily. Then you would tick the second column. If they didn't do it at all, or if they did it very shoddily, you're not at all satisfied, then you want to give a 0. Then there are maybe some steps which are not relevant. Now, suppose if the patient is not already wearing spectacles, you don't take the visual acuity with the previous spectacle. So that step would become not applicable. So this is a very simple, straightforward checklist just to ensure that the person is performing each and every step. But some of the things we've built into this, like for example, this is another checklist for instilling eye drops. You'll see we've built in some of the steps which ensures patient safety, ensuring correct identification of the patient, checking for any contraindicating allergies or anything like that, ensuring hand sanitation before starting, correct eye drops, checking the expiry date. So these are simple things that are related to safety. And again, some things that have to do with patient centricity. Have you communicated to the patient about what you're going to do to them? Have you warned them that it'll burn for some time? Have you warned them that they'll experience blurring of vision? So these are not the actual procedure, but we've built all of this into the checklist because we want, when we say competent, it means they have to do all of this in addition to just instilling the eye drops. So you will see we've been doing this on a pilot mode over the past few years. You can see this is a score sheet for one trainee called Chellamal, where we were looking at evaluating her visual acuity measurement skills. So you can see she has done 25 patients under supervision. This is a formative learning tool. So you'll see in the very early days, she's getting a score of 3s and 4s. But towards the end, she's getting all 5s. This is very much a part of the role of the assessor as well. So if you go back to the first part here where she's getting 3s and 4s, now the assessor can tell the learner exactly where she's going wrong, how she can do it better. And that is why the learner is able to get better and better. Now, all of these 20 to 25, or it could be 5 or 10, depending on the skill, depending on what you would like, how you would like to structure it. But here, what you're seeing in front of you is evidence of learning. At the end of, say, the 20th patient, I can confidently say Chellamal is now competent to perform this skill unsupervised. Not only that, you'll see at the bottom, I'm not only giving visual acuity, I'm also stating that it's just not visual acuity for any patient. I want them to undergo a variety of cases. So I want to, in this 25, I must ensure she has seen pediatric patients with conjunctivitis, so she will know what not to do, post-operative cases, patients with other complications as well. We've gone on to now in our Madurai facility, we've gone on to digitize this, and we're now, I think Corona gave us this time. to move all of this online, and instead of our learners, we use this opportunity to recertify all our employees. So because our previous employees didn't have this benefit, now we use this to ensure once again that they are all still competent. I'll tell you why that's important to do it for your employees in a bit. You'll see the same checklist is now available on a tab form. So instead of ticking on a pen, you just need to click on this touch screen and you'll get the same report automatically. Now you can forget about the digital tab. You can still do this on paper, but I want to stress is we're doing it for all skills, even for simple skills like hand washing. Very important. Are they following all the steps of hand washing in this COVID time that has become so important? For skills where there are no patient, so here you'll see this is a spectacle automatic edging. Even here you are seeing that this skill is being evaluated using a checklist. More complex skills, higher order skills, like here, and skills that actually involve a patient. So you can do it whether you're using actors, whether you're using just partners to do it, whether it is a skill that involves patients or not. Simple skills, complex skills, all of this can be evaluated in this way. So what do you need to do this well? First, the assessor should know what to assess. Very, very important. And I really want to stress upon the assessor because it's not just technically knowing the skill and knowing how to fill the checklist. The assessor integrity is very, very important. So this is something that as we have been rolling this out, we found that we have to go back to the assessor and tell them why it is important to do this in a very strict manner. They should not do it leniently. This is not to just pass somebody or give marks or show someone as competent. This is really to ensure the quality of our care. So you must also counsel the assessor on doing this very, very strictly. And again, like I mentioned earlier, ensure all variations for any skill. So if we're looking at instilling eye drops, you want to give them a variety of eye drops, not only dilating drops. You want to look at anesthetic drops. So for each, the instructions, the communication, some changes will be there. Important is documentation, because otherwise you will not know where a person stands. You will not be able to give feedback. So documentation is very, very important. Give the feedback immediately. Immediately after, for example, here somebody is assessing them, doing a color vision assessment on a partner. So this doctor, as soon as this is over, will immediately use the checklist to share his feedback, where they went wrong or where they could do better. And it's important to monitor progress. If you say, okay, this person has to do 10 cases under supervision, visual acuity, you want to monitor whether they are progressing or not. Otherwise, see what's going wrong. Is it something to do with the assessor? Is it something to do with the learner? Very important. If somebody is found competent today, it does not mean that that person will remain competent after 2 years, because the protocol could have changed, because this person could have forgotten a few steps. I think we're all familiar because we don't always follow the ideal protocol in the clinic. I think you will all agree. This is a way to bring it back. So another situation where I want to stress, especially for those of you who are like Aravind, involved in long-term training. So traditional model, your skill assessment, when do we do it? We recruit a trainee. We would have, like, I think most of us have a 2-year training program. Those of us who have long-term training, we would do a skill assessment at the end of the first year, a skill assessment at the end of the second year, after which they are ready for employment. But what is the truth? These learners are part of our workforce. I think all of you will agree that after the trainee recruitment, during the first year, some of these trainees start doing the work actually on patients. They will be escorting patients, they will be doing visual acuity, they will be doing some of the basic skills. In the second year, they'll move on to slightly higher order skills. And then at the end of it, they go for employment. Now, if I'm going to do the skill assessment only at the end of each year, what the problem is, they have already started doing this on the patients. So what is my documentation to say that they are already competent to do it? Even as a trainee, this person can perform visual acuity measurement. Now, if I have this documentation, I can show that this person is competent. Even though she's a trainee, she can still be part of the workforce because I have proof that she is competent. So I think this becomes even more important in this day and age, because as we move towards uh, certification, accreditation program, we need to show that our workforce, whether they're trainees or employees, are actually competent. So what you're seeing now is a skill matrix. So for example, this is our Madurai team, actually part of the team that takes care of the inpatient care. I've just showed a few skills. You can see how some of them we have recertified this year, because every 2 years now we're saying we want to recertify them for all skills. Even if this person has an experience of 25 years, now she has to be checked. Does she still remember hand washing, eye cleaning, instilling drops? It takes just a few minutes to do this. So I think this is important. You can see most of them who are green have completed this skill. 5 of them are still undergoing this evaluation right now as we speak. Eye cleaning again. All the orange ones are pending. I want to show a few of the other skills which are more specialized. Like for example, counseling for cataract, everybody needs to know this skill. But if you look at counseling for pediatric surgery or corneal surgery or for retinal cases, may not be necessary for all patients. So here, this is where I say it is enough for these two persons to know how to counsel for retina patients. Only they will be posted in the retina ward. So next time I want to replace this person who's here, I will have to ensure that that person is now trained, found competent for this care, and only then posted in that ward. This is very, very important. You will hear that in NABH and this kind of accreditation, you will see that privileging is very important. I have to show what are the different what are the different procedures done here, and is each person appropriate or competent to do that. So now I think this is slowly becoming mandatory. So this is becoming more relevant nowadays, this proof or this evidence rather. So that's been my time. So thank you for all your patient listening.